The unchecked outbreak of syphilis among indigenous communities in the Great Plains region has reached alarming levels, with devastating consequences, particularly for newborns. Despite efforts by local health officials and tribal leaders to address the crisis, the response from federal authorities has been slow and inadequate. The rise in syphilis cases among Native American babies in South Dakota is deeply concerning. It reflects systemic failures in healthcare delivery and underscores the urgent need for immediate action. Pediatrician Tom Hare's observations on the Rosebud Reservation highlight the severity of the situation, with newborns facing life-threatening complications due to untreated syphilis infections. The request made by tribal leaders for a public health emergency declaration from the U.S. Department of Health and Human Services, HHS, is a critical step toward securing the resources needed to combat the outbreak. However, the lack of response from Secretary Xavier Becerra and other federal agencies is deeply troubling and exacerbates the challenges faced by affected communities. The delay in federal assistance is particularly concerning given the preventable nature of syphilis and the potential for further spread of the disease. Without immediate intervention, more infants are at risk of suffering from severe health complications or even death. The inadequate funding and staffing levels within the Indian Health Service, IHS, have also contributed to the crisis. Chronic underfunding and staffing shortages have left healthcare facilities ill-equipped to respond effectively to infectious disease outbreaks, further highlighting the need for increased federal support and investment in tribal healthcare systems. While some efforts have been made to address the outbreak, such as collaborations between IHS and state health departments, more comprehensive and coordinated action is needed. This includes prioritizing access to prenatal care, implementing widespread testing and treatment programs, and addressing barriers to healthcare access in tribal communities. Ultimately, the federal government must fulfill its obligations to provide adequate healthcare services to indigenous populations and take immediate steps to address the syphilis outbreak in the Great Plains region. Anything less would be a failure to protect the health and well-being of some of the most vulnerable members of society.